Dr. Kleinöder, since 1919, has been lecturing at the German Sport University in Cologne at the Institute for Training Science and Sport Informatics. Since 2003, he has been heading the movement research and strength training department, and he's one of the leading experts in EMS research. And his topic today is EMS, current insights and studies, and we're of course excited to learn the latest facts and figures. Please welcome Dr. Heinz Kleinöder. Well, thank you very much. I would like to welcome you cordially. I'm happy to be able to present some results of our studies here. Before we get going, I would like to touch upon a few things I was confronted with. The current trends, security, safety, the safety of EMS. There were many things that are really questionable. There was a contribution in a press release saying that neurophysiologists warn of excessive loading and renal disorders. And I actually delved into this, drilled a little deeper. Then there was the Bild Zeitung, the Bild Daily. I looked at the article, read it through, and what happened, and quite interesting to notice the following. In the annex, I was mentioned as a co-author. As you can see here, the Sport University in Cologne found out that with EMS training, the CK increases 18 times higher. And this is the reason, and this was the study. And I was actually cited as a co-author. This is interesting because the study that is underlying is a completely different one. This study was misquoted. The right study does not date back to 2010, but dates back to 2006. It was published internationally, and it is a study that even received an award. They referred to this study. This is data provided by the Waterball Junior team. They went through a very intense training. It's an old study, as you can see. And the result was that when the athletes tried to reach the maximum in terms of intensity and competition sports, people like to do that, then CK values can reach 7,000 units per liter that are very high. But this doesn't have to do with training. They simply tried out how high can I go? And when the training was continued, these values actually dropped back to normal. And as you will hear from Professor Kemmler, that you can even reach higher CK value in other studies, then just take it like that. But one thing is for sure, this study here does not have anything to do with what's been said here up front, because there was no damage whatsoever caused. This was simply misquoted. Let's summarize. There was a wonderful expert opinion, and it reads like this. EMS, whole body EMS, is considered an absolutely meaningful, effective, and safe option for people. Why? Simply because you don't design a training to go up to the maximum intensity. No, instead you try to find the right application options for EMS. And they were also laid down in the Deutsche Zeitschrift für Sportmedizin. And the idea is to set tolerable stimuli, use skilled trainers, then actually work out a perception of movement for certain groups of muscles instead of focusing on pain. Then static or dynamic loads should actually be executed with a sub-maximal intensity, and listen to the person you're training, especially when you do whole body EMS. Then all exercises should be actually mastered safely. If this is not the case, it's not functional. And you should actually opt for 2 training units of 20 minutes per week max. You know that people often only train once a week, and in a safe environment with a personal trainer. So compared to many, many other types of trainings, this is a very safe method, considering or complying with the insights I've listed here. Maybe 2 or 3 more things on the training process as such. Here you can see that we should always factor in that there is a sufficient calorie intake before training. Then the wattage needs to be dosed. Then adapt the pauses, the breaks, and always have individual regeneration phases. When you only do it once a week, this is not really a problem. When we train with athletes, it's a different story because we train 2 to 3 times a week. Maybe some recent studies. Unlike last year, I've shown in this chart how such studies come about for competitive athletes. The German Sport University actually looks for cooperation partners from the Training Academy in Cologne, and there you find champions, world champions from all of the sports, with the exception of football. And once this has been planned jointly, you actually submit it to the Federal Institute for Sports Science. And now, in competitive sports, we can cooperate with open studies. So I'm not saying we go for this or that study design and we then look at the results. No, we actually go for a joint study. And the first applications took place 4 years ago in Kabern-Weinbuch. This was the training just for the thigh muscles for ski jumpers. Then another study focused on luge sports. We first observed, we actually worked with Hackelschorsch. We looked at whole body strength training, the back muscles, and wanted to strengthen the belly and the back and the arm and the shoulders for increasing or accelerating starting times. Here, EMS, the way we use it in combination with the sling trainer or in combination with the medicine ball or in combination with your own body weight or resistance running, for instance. Of course, we also combine it with long dumbbells with various loads, simply to see how much or what happens when we actually produce a double stimulus, mechanical load and EMS, and how is this leveraged for a sport. Here you can see classic uses for sprinting and jumping, highly dynamic. We actually apply as much power so that all of these movements are possible, both for the leg muscles and for the arm muscles, for hitting, throwing. We've gone through many studies there, and almost always dynamically for competitive sports. Still ongoing, and this is why I can't present any results yet. We started the study last year. This is a project for establishing a whole body EMS for German athletes for throwing sports, for spear, discus, hammer. So we actually do strength tests. And the project was started with Matthias Rau and the Athletes Association. It's still ongoing. This is why I can't present any results yet. Like for this one, with Jens Filbrich, it's with Nordic combination. So we want to use this study to help Nordic combination sports people. These are studies that we're running with the association and the trainer in charge. Professor Kammeler is sitting here, and I'm happy to see him. This is a joint study that also started. This is this one. The effects of alternative training technologies on chronic back pain for back pain patients, considering its sustainability. This is exciting because both EMS and vibration are intense processes over a short period of time, and we do, of course, hope that the effects are far more sustainable so that back training can be maintained. And let me go one step further. Let's look ahead in time. This is the project proposal we submitted this year, because in competitive sports we've done the first studies, and the trainers, of course, ask us how should we design it to have a specific effect, which is not easy to say. And this is why we submitted or presented this proposal. Use of EMS in the structuring of high-intensity training for 433, 85 hertz, but we want to go more broad-based in individual applications, and then we'll try to actually introduce this into the competition year. So what can you expect in terms of improvement? And one last excursion. We will stay in Cologne. There is a very interesting project with the airport fire brigade, and we want the fire marshals to be fit. They are subject to a lot of load because of at least 20 kilos they have to carry, and when they have to carry hoses, this is up to 70 kilos, and they have to work till they're aged 65. So the brief for my working group was to design a training for fire marshals and to work out diagnostics to retain the ability to work of these fire marshals. And this will be checked by EASA very soon, because we have to ensure that these people can work properly. Their EMS will definitely form a major part. So this is the things we're currently busy doing, but let's look at some studies that have already produced results, and I would like to present them from the viewpoint of the sport university. EMS is a serious treatment for a specific clientele, where there was a wonderful project at the Bad Oeynhausen Heart Center. Those people want to be able to walk again. They're not interested in competitive sports. EMS was used at the Heart Center over a number of weeks, and this was published in the Herz magazine. There were no dropouts, but there was a significant increase in the maximum strength, and when strength increases, then endurance also increases. So we had an increased oxygen uptake at the anaerobic threshold, and we also had positive impacts on blood pressure. So this is highly specifically recommended for chronically heart insufficiency. The DFG study for back pain. Böck-Behrens have initiated this with a first broad-based study. These studies are more broad-based, but not so in-depth. But they actually reveal a very high potential, because after all, over 87.3% of the people said that their pain had reduced. Then the positive effects on the musculoskeletal system, then an improved trunk stability and a reduction of back pain. So this method is already an established one, and we're trying to actually go one step further with the DFE study. What is important for us and for you, Whenever you want to make things easy, when you want to allow a movement to be made easily, we depend on maximum power, maximum strength. When maximum strength is higher, then all other things seem to be easier. There are beautiful reviews in literature that cover everything. These are all studies, individual studies that you see here. They're scientific studies, some of them. For untrained people, you can actually improve the isometric maximum strength after EMS training by 23.5%. The trained athletes even actually increase their isometric maximum strength between 15 and 40%, on average 32.6%, probably because they actually go for a higher intensity training. So maximum strength can always be improved. Hypertrophy is a factor that's easy to remedy with other methods, but specifically with EMS. Another point is, of course, speed. Speed and acceleration is a different point, because you need to be able to actually call off your strength immediately or in a very little amount of time. So contraction speed can be increased. Then we also looked at EMS training for increasing the movement speed, and we were able to actually increase the movement speed of the leg flexion muscles by 30% approximately. And we focused on the quality aspects here. And last but not least, especially for competitive sports, we can combine classical training, strength training, with EMS training, so that both performance factors, which is strength multiplied by speed, can be improved. And then there are further studies on the static strength endurance, which is also important for competitive sports. And you can see incredible increases, an average of 30.3%. For the dynamic strength endurance, it's even higher, standing at 41%. And people always ask us, could we actually change over muscle fibers temporarily? Yes, you can. Whether you want to do this with competitive athletes is a different question. But there were studies, long-term stimulation with a low frequency, and we applied this to rabbits. We know that rabbits are very fast, and when you actually do it long enough and expose it to a low frequency for a long time, then you get a marathon rabbit. The rabbit has a higher endurance, but if the stimulation is actually no longer applied, then this endurance is of course lost over time. Then sprinting and jumping. We have excellent results that we can actually show here. Sprint studies say that 3 to 4% of improvement can be achieved. This sounds little, but in competitive sports, this is an extreme improvement. Then combined strength training with EMS also produces excellent results for jumping strength of 11% with a standard variance of 5.5%. So again, for sprinting and jumping, we also have positive results, both for competitive sports and for amateur sports. This was a tour de force on my part of all of the various things we do for competitive sports. But I want to return to what I said initially. We really have to watch out. This is a stimulus that is very effective. There are many, many highly scientific studies. There's a host of scientific studies, verified studies, that prove that these stimuli are effective. And we must make sure this is not discredited by a few people who actually jerk up the power to maximum. We should pay attention to this because this damages this beautiful tool. There's hardly any stimulus that has been studied as well as EMS for rehabilitation purposes, for instance. It was clearly seen that muscular atrophy can be reverted, can be avoided by EMS. What is very interesting for me from the sports university in Cologne is the acceleration improvement. So I have to learn how to adjust the stimulus in such a way that it actually produces this fantastic effect. And together with Professor Kemmler, I'm now acquiring new experiences in sports for older people. So I'm also learning how the stimulus can be optimized for people who are not competitive sports people. So much from me, and I look forward to questions and your discussion. Thank you very much.
Ja, haben Sie Fragen?
I'm interested in getting your opinion on low frequency and medium frequency training.
Well, basically, medium frequency is fine from my point of view. The only problem I have with it is with low frequency power, we have zillions of studies. With high frequency, you've got a host of studies, but for medium frequency power, there are hardly any studies. At the sports university in Cologne, we had a problem because the low frequency applications use statements made for high frequency. And we were to be pushed to say medium frequency is the stimulation. It's not a stimulus, but an activation. I don't see the difference here. I have a problem with this because the approach was too aggressive, and this is why I didn't do any studies about it. There were only few studies available for medium frequency applications, 2 or 3 maybe. They're not negative, but I have to admit that I withdrew because I did not like the way I was approached. But again, this is not to say that this stimulus cannot be effective. But please understand, representing the sport university, I cannot do anything that is biased. I need to be unbiased. And this is why I can't give you any
Much for your lecture, and well, please give a round of applause to Dr. Kleinöder.